Okay.
Vaccinations have been around for many of years. Vaccines is an antigenic material to improve a person's immunity. Vaccines are given to prevent children and future generations. When children are born, their immune systems are very weak. They can acquire infectious diseases that we don't have treatable conditions for. First, nurses and doctors need to be well educated so they can educate others, like the parents. Nurses and doctors need to be up to date on new information about vaccines, infectious diseases, and others. They can educate the parents so they can make well decisions for their kids. Parents can refuse for many different reasons, some being religious beliefs, others being government conspiracies. Some religions don't believe in vaccines and don't believe in some medical health care. It's the physician's job to treat people and how they can do their job when people are refusing treatment. Children have no say in their decision, so it's the parents' job to make these decisions. It's supposed to be the best interest of the children, but the children has no decision. Those parents who decline vaccines are known as free riders, according to Cheverbank, McClue, and Brent. They are going to benefit of herd immunity without assuming any burden of their children. That's what a free rider is. This can lead to child neglect. Once a child neglect is reported, it goes to the state agency to further persuade the parents. The state then has control over the say of the parents. Maximum efforts to protect the child could be removal of the child from the home. This would be putting the child in supportive custody of the state. Without proper vaccines, children cannot attend school. We all have those nurses that acquire our vaccines throughout the school. This is decreasing the future generations from getting other diseases. Children who do not have proper vaccines are known as vectors, according to Cheverbank, McClue, and Brent. When needing to see a doctor, those children that do not have proper vaccines are unable to schedule appointments accordingly. They can't see walk-ins. They have to make appointments late in the day so that vaccines and it's less possible contamination for others. If they are seen in the ER, they have proper infectious disease precautions like isolation and other rooms that other people cannot go into. When children have had proper vaccines, they are less likely to have other health conditions later in life. This improves health conditions, lowering the cost of health care, and making our government easier to provide health care for others. I have this handout here accordingly to show the vaccines that are properly given to children. This is a handout from Lumen, Barker, Shaw, McClowie, Briller, and Pickering. As you can see, it shows that hepatitis B is given from 0 to 2 for their first dose. Next, they get their second dose 1 to 4 years of age. Then their next dose is 6 to 18 years of age. They have minimum acceptance age for each one. If a child does not get their percent dosage of each age, then they go on an altered schedule other than this. Once an altered schedule is given, each dose is decreased because a child cannot receive appropriate dosages for each time they receive the shot. Other vaccines that are given to children are diphtheria, tetanus, polio, measles, and mumps. All of these diseases are deadly and can cause outbreaks throughout the world. Showing an obstacle for some parents is affordability. Although health care is a necessity, it is very expensive. Our health care in the United States is not universal coverage. This is not okay because our government does not provide health care for everyone. Finkelman and Kinner state that there are 48.6 million Americans uninsured, making it very expensive for them to provide health care. Their children are at cost here. They cannot provide vaccines for these children, making it hard for them to pay and even harder for them to get the care they need. In 2004, only 74% of children aged 19 to 35 months have received the 4th diphtheria tetanus vaccine, according to Domofsky, Lance, and Freed. This is awful because 74% of our children are not receiving all of the vaccines they need, causing more of an outbreak, causing more of outrages, and more infectious diseases in the world. More places will have to offer vaccines. For those who do not have transportation or live in an area of severe poverty, an idea could be doctors take vaccines to them. Even though vaccines are not guaranteed prevention, they greatly reduce the risk. The most important is parental education. They are making the decisions of their children getting vaccines. Epidemics can be prevented, death can be prevented, and other illnesses can be prevented with vaccines. Show it.